Right. Shall we? All right. Good afternoon, ladies and gentlemen. We welcome all of our daddies and mommies to our Mommy, Daddy, and I parenting series, Facebook Live, where we'll bring you the topic covering for from infancy all the way to early childhood. So, well, I mean, expecting a baby can be a very exciting journey and also comes with a lot of challenges, which is especially for new parents here. Which is why today we bring you the topic of a newborn care workshop for new parents, where we have this sneak peek review to your parenthood. So, hoping that we will just help you a tad bit to get a bit well versed in terms of taking care of a baby. Yeah, so today we are very happy to have a workshop with two speakers. And before that, please let me put credits to Baby Carrie as well as Lotus for helping us to make today's event a success. Well, Baby Carrie might sound familiar because it is actually from the same company as Carrie Jr. However, they had tailored and formulated their products for the unique needs of newborn babies. So without further ado, please allow me to introduce our speakers today. We are very honored to have to be able to invite two highly esteemed speakers, which is first Dr. Reliza, where she graduated from Med School of since 1994, subsequently completed her training as a pediatrician in HKL and HUKM in 2001, which is now she is a full-fledged pediatrician in Avicenna Women's and Children's Specialist Hospital. Yeah, as well as we have a second speaker, which is Miss Alpani Binti Ramli, which have been trained for nursing at KPJ International College of Nursing and Health Sciences, where she has her special interest in breastfeeding and now a full-fledged lactation educator in ONG department at Glensigo, HKL. And I think one more important thing, she's also a mother of three kids, which is we're very happy to have her here to share with us her experience in terms of this as well. So, well, I mean, being pregnant and welcoming a new life, it's hi, Mr. Fanny. It's a sudden transit. You're here already. Hi, how are you today?
Hi, good. Thank you, Dr. Eric.
Yeah. So, Miss Albany, so without further ado, let's just kickstart today. Yeah, we kickstart today's this workshop. So, of course, we would like you to share with us. I mean, being pregnant and having a new baby, it's a truly it's full of joy. And at the same time, it's full of very kanjong, a lot of stuff that you don't know here and there. Yeah. So, or do you mind to like just share with us like when you first got pregnant, any problems there like morning sickness, all kind of like or mood swing, like or tonight I want to eat tengah malam I nak makan nasi lemak ke or something like that. Yeah, I mean, any experience, interesting thing you can share with us. Yeah.
All right. Okay. So thank you, Dr. Eric, for the kind introduction just now. So like what Dr. Eric did mention just now, I'm a mother of three, and recently I just delivered my third one. It's not recently, last year, on March. He just turned 1 year old last week. All right. So the memory of the pregnancy delivery is quite still fresh in my mind. All right.
Mm-hmm.
So but basically, I think I'm one of the lucky enough because throughout my three pregnancy, I don't really have a bad morning sickness. I
Okay.
not even have episode of vomiting for
Mm-hmm.
all of my three pregnancy. I'm very
Mm-hmm.
lucky from having that experience
Yeah.
actually.
Yeah.
But basically, I just want to share that for my third pregnancy, which is last year, I caught COVID at 38 week, 5 days before I
Oh.
delivered my third one. All right, so it will be just a different experience compared to my two previous pregnancy before that. Okay. Other than that, my pregnancy is just a very smooth one, but we cannot avoid from having feeling of tiredness as a working mother. All right, so because of the physical changes that we go through throughout the pregnancy, which is very normal. So for mother out there, for any changes that you have in your pregnancy, what you need to do actually, just keep positive. If you think that you need more rest, okay, rest more. And cooperation from your husband is very important. All right? So that you can go through the pregnancy process well. It's not when you get pregnant, it's not only you and your baby, it's actually involve the family.
Yeah.
So when you feel tired, you feel that you want to have rest, just talk to your husband. I'm very sure they will be so happy to help you actually throughout the journey. Okay,
All right.
Terry.
I think everyone has their own very special and unique experience in terms of getting pregnant and getting ready for the delivery. But I mean, right after you had delivered, just for instance, I mean, I'm not a father of a kid. I'm not a father yet. So I mean, yeah, once you're a mother, I mean, how does it? Is there any difference like when your baby is just born? You need to really like what they always say, midnight 2 a.m. You need to wake up for breastfeeding. Then you have to like change the diapers, or sometimes you're just like so tired, you just maybe even melt down or something. Yeah, you mind to let us know more about this?
Yes, absolutely. Because once you become a parent, once you become a mother, 360 of your life will change. New routine, okay? Even there's a new person in your room that you need to taking care as well. And I always share with my patients after they at the hospital, because basically like my job as a lactation educator, I will see a lot of parents after their delivery. So I always advise a mother, okay, when they become a mother, okay, number one, what they need to do is love herself first. Mean that love yourself first. Only then you can love your baby more, because most of the time, mother, they love to sacrifice for the baby. Okay, absolutely everything will change. There's no more like 6 hour, 8 hour sleep, prolonged sleep. You only will get that maybe in your dream. Okay, you need to wake up baby, right? So you need to wake up your baby. You need to change your baby diapers. Okay, you need to like find a reason why your baby cry. There's a lot of things will happen, especially for the first few weeks of the delivery. You will learn a single thing every day. All right. So the key is you need to stay calm. Okay. Prepare yourself with some knowledge so that you don't feel so like, oh my God, what happening? And then, like I mentioned just now, Dr. Eric, at the earlier part of the discussion, love yourself first. Okay. Prioritize yourself. Only then you will go through the process well. Because if you only think about the baby, you want to do the best for the baby, you not even have a time to go to the toilet to pee, you don't have time to eat, it will be more stressful, and you might feel that, oh my God, what happening, right? Is it I need to give this baby to someone else so that I can rest? Okay, so love yourself more, that so that you can love your baby more. Okay, maybe that is some tip that I can share with all the new parents out there today.
Yeah, that's great. That's great. Awesome. So, I mean, for all this, I think another major challenge would be when you're first time trying to bathe your baby, probably. Because, I mean, bathing would be, definitely it's going to be a total mess, you know. When you put them into the water, they'll just feel uncomfortable, they just fight, and they just throw tantrum. Do you have any experience, or you have any possible tips that you can share with us what we can handle with that?
Yeah, okay. So Dr. Eric, maybe I'm quite lucky enough because as a parent craft educator, it will be one of the topic that I need to teach a mother on the bathing part of the baby. All right. So maybe the challenge here that actually is basically to my husband. Because after I deliver a baby, after just deliver a baby, so I don't think that mother will able to bath the baby after the delivery, right? So it always take two person to involve with this to raise a baby. So what I did actually, Dr. Eric, okay, maybe you can do the same after you get married and you are expecting a baby, right? So I bring my husband to a parent craft session where in the class, okay, in the class, the nurse teach parents on how to bath a baby. So at least, okay, when I have my own baby for my first one, so my husband doesn't give an excuse that I don't know how to do it. Because I already bring and prepared him with all the
Okay.
knowledge. right?
Yeah.
Because he cannot give an excuse like, I don't know, I might harm the baby. I don't know what is the picture that is suitable for the baby because I already prepared him with all the knowledge before I even born the baby. So maybe mommy out there, you can do the same. You can just join the class. If mother, mommy, daddy, and I did organize any parent club session, you can just join so that you can equip your husband with all the knowledge because to handle a baby is very challenging. It might be something that, oh my god, it's very fragile. You might feel that, oh, is it I might broke the baby's bone? But actually it's not. Okay, and most of the newborn, okay, they will not really enjoy their bathing. Okay, but when they grow older, okay, when they are 1 month old, 2 month old, they don't even want to stop bathing. But for they might even cry when you bring them out from the water.
Oh, okay.
For a newborn, okay, especially for the first few weeks, most of the baby, when we start putting them in the water, they might cry. Okay, so the tip is just to keep calm, do as fast as you can, so that you don't really let the baby long enough in the water because they are not really dirty, kind of Terry. They are not
Yeah,
really with the mud, with the
that's
dust.
true.
They
That's
not
true.
even sweat a lot. Okay, so just do a quick one. Okay, and stay calm when the baby cry. Just stay calm. You just need to make sure that when you bath your baby, you already like prepare sometimes that you don't rush. Okay, so you know that, okay, I will spend half an hour to bath the baby. All right, so if you have a phone call, just let the phone ringing. Don't like left the baby in the water.
Yeah, yeah, yeah. True.
Thing, and that is what you can do. Prepare yourself before you
Mhm.
bath the baby so that you don't feel like, okay, what to do next, like that.
Mm. Okay, all right. I think with all this, I think the most important thing I will conclude is get your husband ready.
Yes,
My dear viewers,
absolutely.
get your husband ready. Put them in a workshop. I don't care. You must learn, and you need to get ready for me. I don't care about it already.
So they don't give excuse after this that they
Yes.
don't know.
Correct. Okay, thanks a lot. So, I mean, we can really see that expecting a baby is so much more. It's a very exciting thing. And moving on, why not let's invite Dr. Reliza as well. Hi, Dr. Reliza.
Hi, good
Hi.
afternoon,
Yeah, good
everybody.
afternoon. Yeah, I mean, no result. We were just chatting with Miss Alpani just now regarding her this what they call this pregnancy journey, having a baby, getting pregnant, and so having a baby out. Yeah. So I mean, definitely you will be able to relate to some of it because I mean, you're a mother as well. So why not? Is it fine if we were to get your help to share with us your personal experience as well regarding this?
I was actually just the same as Miss Alpeni because I didn't have that much morning sickness. So my routine did not change that much. You see, I was a medical officer when I got pregnant, so it was like I can still do calls and work like usual because I didn't have a slightest vomiting, and that was like really good, you know.
Oh,
But
okay.
but of course, when you're expecting a new baby, you must prepare yourself, just like what Miss Albani said. Yeah, no, you and your husband must be prepared. Of course, when you are expecting, there are always, everybody will be happy, but at the same time, you'll be like nervous, scared, anxious because you don't know how your baby will turn out to be. They can either be a very good baby, cry baby, fussy baby. So
Mhm.
you have to be prepared to actually face all this.
Yeah. Well, I mean, unfortunately, I had two very lucky speakers that had no problem with their pregnancy at all. I know, like today, I got no much to discuss already. All right, let's move on. I mean, today we will discuss mainly regarding this bathing and cleaning up your baby, cleaning your baby. So, because we do know that some parents might get really anxious regarding this task. Yeah. Um, so, I mean, Dr. Riza, would you have any tips regarding this? How to have a better, how to get themselves a bit more ready to have a better bathing experience between the parents as well as the kid, the baby. I mean.
Actually, there's no particular tips. Just like I think what Miss Penny said was right. You have to
Mhm.
be prepared before the arrival of your little ones. Yeah, there are a lot
Mhm.
of there are a lot of channels where you can actually learn how to bathe baby. One of it is like workshop, the one that she has mentioned. I'm sure there are a lot of videos, for you to watch how to hold babies, how to prepare, how to bathe the baby. And I'm sure as a first time parents, you will also get a lot of help,
Yes.
from relatives, mother-in-law, sister, and sometimes now confinement ladies are very famous. So we do have a lot of confinement ladies that can help around, you see. But I think the basic things is that you just like relax and calm. Don't be scared, because I know first timers, they are scared, especially how to hold baby, is the water temperature right, what if water is too hot, what if the baby sleep while I hold them. So this thing you just have to push aside. You just make sure that you're ready and you're calm and relaxed and just enjoy the parenthood journey.
Yeah. Just enjoy the process itself, and
Yes.
as well as, I mean, definitely there'll be a lot of help coming in. The mothers-in-law and father-in-law will have all kinds of ramans and
You will definitely get a lot of help, especially you're a first timer.
So Miss, just come back to Miss Apani. Just wondering, how often do you bathe your baby every day? Two
Okay,
times,
so
3 times, or
right. So basically, I bathe my baby 2 times a day, but it's according to the weather. If the weather is cold, I might just bath the baby once in the morning, and in the afternoon I just punch the baby. So it's dependent.
Mm,
But twice a
mm,
day or once a day is enough for a newborn for me to take a bath.
I see. But I mean, if from a pediatrician point of view, Dr. Reza, well, how often would you recommend all this?
Okay, you may not bathe your baby every day, also depending on the situation, yeah. But one or twice a day is adequate, because baby skin is very delicate, so you
Mm,
cannot bathe them very frequently because it gets dry and
mm,
irritated, and they can get easily damaged.
I
So
see.
it must be like only once or twice, and if it's cold, just you just like sponge them with water, and you have to give like special attention to the neck, behind the ear, and the genitals. You can also do that with sponge bathing, and you must make every bath short and quick, 5 to 10
Mm,
minutes.
okay.
And before you start bathing your baby, you need to have everything ready.
It's really.
Towel, clothes, lotion, diaper, yeah. So once you get everything ready, then only you start bathing. If not, you'll be like, while bathing anak, I forgot the towel, then, everything will be disrupted, and you will actually prolong that process,
Yeah,
which we
yeah.
don't want that.
Yeah, too kelam kabut, then you will get everything very mess.
No towel, nothing. There are a lot of things that can happen. Child becomes cold, and then they start crying, then everybody gets panic, that kind of thing.
Because I think the whatever the parents' energy when they are bathing a baby will get all directly portrayed to the baby. If the mother is like, macam mana kelam kabut macam ni, I think the baby will
Yes, yes,
feel
yes,
that.
yes. That's why I said you have to get everything ready, so that you
Yeah.
are not like, all of a sudden, alamak, I forgot this thing, I forgot the towel, I forgot the diaper,
Yeah, yeah. Anything else you think you can we can help to like ease the like get the baby to be a bit more relaxed, a bit more calm per se. I heard some they saying that you can even play some music, or I don't know whether the music is for the mother or actually is for the baby. Actually, Uh,
Bathing can be very stressful to babies. Most of the babies, they don't like uh, to have their bath, especially the first 1 or 2 weeks. So
okay.
the most important thing for you to make sure that they are calm and relaxed is your water temperature. Your
Mm,
water must be at the right temperature. Yeah, it must be warm. It cannot be too hot and it cannot be too cold. Hot, of course, it will burn the skin, and too cold, it will make the baby uncomfortable and they will start crying. Yeah,
mm,
and so how do you test your water temperature? Is by using your elbow. So once you
mm,
prepare the bathtub, so you just check the water temperature with your elbow or with your wrist, because
mm.
that is because your hand is the skin is a bit thicker, so it's not that sensitive to the temperature. Yeah, and then you need to hold them properly, because if you don't hold them properly, you will make them uncomfortable. Yeah, okay. So in a baby, when you want to bathe them, yeah, you always start. Of course, this baby is wearing baju. You just imagine that they've got no baju. But usually, what we do when you want to bathe the baby is you start with the head. I think Miss Alpini can. I think she's better in terms of bathing baby because she's a parent craft instructor. So what we do normally, you always bathe the head first, yeah. Okay. So you just balut, swallow the baby so that they won't get cold. So you wash the head, yeah, using the water from the tub. Yeah, okay. So you wash the head. So once you're done, so you take the baby out and you wipe. You wipe the head, then only you wash the body. So that they won't get cold. Once they get cold, then they will feel uncomfortable. So you did mention about music. Yeah? Music, actually, when you put on the music when they are bathing, you actually distract the baby. So when you distract them, they are a bit more calm and they don't pay too much attention to the bathing.
Okay.
So some people say you can put on music or you can talk to them. So while bathing, you can actually talk to them. You can talk about anything as simple as you explain to them what you're doing. Okay, now I'm washing your hair. Now I'm washing your body. You know, I'm using this very nice soap. You know, these kind of things. Or you yourself sing to your baby. You know, and that's it. You know. So mummies out there, please go and memorize all your nursery rhymes so that you can use your nursery rhymes to bathe them. You know, so you don't need music. You just use your own music.
Yeah. Okay. I think that keeps the mommy calm also as well at the same
Yes,
time.
exactly. Because when you are singing, your fear will all go away. You see.
Yeah. Right. Okay, Miss Avani, thanks again. So when we're looking for, I mean, when you bathe your baby, definitely nowadays, mommies and daddies out there will start to look for like all sorts of products in the market. There's too much thing for them to choose from, lotions, shampoo, creams, or whatnot. So, do you mind to share with us when you first started to look for it? What is your criteria in looking for the various products that is most suitable for your baby?
All right. So thank you, Terry, for the question. So I'm very sure all new mother that joining the session today, especially if you are first time mother, you are like asking everyone like what is the product that your baby use? What is the product that your baby uses? Is very common. Even for my third one, because I don't have a newborn for 5 years, so I even asked my friend the same question. What is the current product that are very good in the market now? Because that baby skin, they are very delicate and fragile, like what Dr. Liza said just now, right? So as a parent, as a mother, absolutely I want the best and the safest product to my baby. So I always look for a product that chemical free, paraben free, that is supposed to be safe to use on the baby's skin. Like we cannot just use a normal adult product on the baby's skin because their skin is different. So that is what kind of product that I think that me myself will choose chemical free and safe for the baby's skin.
I see, I see. Then what about Dora Liza? When you're teaching your mummies, yeah, how do they choose? What would you usually emphasize them on to be to take care of? What ingredients they need to be careful, or what they need to be avoided when they're choosing their own products?
I think it's more or less the same. We go for product that is medication free, toxin free, and chemical free, because baby skin are very delicate and they are prone to skin irritation and rashes. Yeah, especially those with the dry skin type. Yeah. So go for a product that is paraben or sulfate free. So in case you don't know, paraben is actually a preservative that is used in shampoo or soap to actually keep them to make them last longer. Yeah, so that's why they put paraben in shampoos and soap. You try not to use those in babies because paraben itself has got risk to our health. It can affect our hormone. It's endocrinological effect. So in long term, it can affect your hormone. So preferably don't use all those soap with paraben and sulfate. And you also go for soap that is hypoallergenic. Hypoallergenic means very good for sensitive skin. As I've mentioned, baby skin is very delicate, and they can get rashes and it can get skin irritation quite easily. So if those baby bath that is not hypoallergenic, their skin can become very dry. Especially those with problem like eczemas and all. So go for hypoallergenic product and tear free, of course. Because when you bathe them, sometimes you don't know the soap can get into the water. It can get into the eye. So once it gets into the eyes, then it causes them irritation and they start crying. And then everything goes, haywire. And of course, find something that can give a long-lasting moisturizer. Moisturizer is very important for baby skin because it keeps them moist. Because once if they are dry, they are prone to get rashes.
Okay. So actually, surprisingly, there's actually a lot of criteria so you need to look into when we're choosing all these products.
Yes, I agree.
As nowadays outside there's so much products and so much of chemical composure mixing up and everything this and not. Sometimes it does raise a concern to the parents regarding what products they need to choose and look for. So I mean, so we do know that baby skin is much fragile, and it has a ratio, it has a much bigger ratio compared to adults. But what I was told that a good bath, a good warm, cozy bath actually can keep your baby calm. Make sure they sleep gao. That's the most important thing as a parent. I think you must make sure your baby sleep as much as possible.
Hungry, wake up already. If you're hungry, they wake up.
But I mean, there's a really good quality warm bath or some sort will help to, get them to have a good sleep, keep them a bit more calm compared to the daily one, the others lah. I mean, yeah, Doreza, what do you think? Warm bath.
The warm bath, there actually a lot of research that has been done about warm bath and sleep. I mean, the researchers all said that warm bath can actually help insomniacs to sleep. Because so if you're the type that cannot sleep, you have insomnia, so you go and have yourself a warm bath, then after 1 hour you will definitely go into a very good sleep. Right? Okay. So it applies the same to babies. So if you give them a warm bath, they will get a very good sleep. Because what happens when you have a warm bath, so when you soak yourself in a warm water, you will actually cause your blood vessels to vasodilate. It opens up. So vasodilation of the vessels means your vessels are all open up. So when you open up all your vessels, there will be a lot of circulation and increases a lot of circulation and blood to the surface of your body, to the skin. Okay. So when you have completed your bath, the moment you stop bathing, your blood vessels are still open. So because of that, you actually lose a lot of temperature and it will bring down your core body temperature. So warm bath actually cause your core body temperature to go down.
I see.
You understand? It works the reverse.
Okay.
So because it vasodilates and it causes temperature it causes your body to lose temperature. So when your core body temperature goes down, it will trigger your sleep center. Ting, switch off now. So it works like that.
Okay, something new actually.
So it's because of your reduction in the core body temperature that triggers your sleep center to switch off.
I see.
So it goes to babies. So if you want them to have a good night's sleep, then you bathe them. The recommended time for you to give them a night bath will be between 5:30 to 7:30 p.m.
Mm-hmm.
So normally they will, after 1 hour, they will start sleeping, feed and sleep. So just nice 8, 9, they will sleep.
I see.
Right.
I see. Okay.
So mommy
Thanks.
used to sleep at that time.
Yeah, can go to buka puasa as well. Yeah.
Yes.
Yeah, thanks, Dr. Riza. So, I mean, Miss Abani, what about you? Had you had experience regarding this giving them bath and you realize that your baby actually sleeps a bit better? I mean, you do have, in your hospital setting, you do bathe a lot of babies as well. Do you see any difference between bathing, not bathing, you know?
Basically, even for my own 3 kids, I bath them in the warm water when they are still newborn. Because I think that with a warm bath, they will be more relaxed, like what Dr. Reza said just now. The cold temperature might make our baby cry more because they might get shocked when they are put in the water. All right. So the warm bath. Okay, I did my baby bath late in the evening, like what Dr. Reza said just now, like around 5:36, I will bath them, right? So that, but Eric, there's no cow sleep for a baby, like for 4, 5, 6 hours sleep, okay?
Impossible.
That's what I'm saying. Please.
Maybe you can sleep, but not
They
your
wake up
mom.
like every 2 to 3 hours for feed. So if they get like very good 2 to 3 hours of sleep, it's like
Yes. You
marvelous.
are so lucky, Mila.
Very
That's why I'm so
lucky.
far ready from being a father yet at the moment.
But
Some
at
will
least
never sleep at night.
yes, but at least after the warm bath, after that we feed the baby, so we can see that baby fall asleep more free, exactly after the feeding, after the warm bath, because of the warm bath. After that, we feed them with the warm meal. After that, they can sleep well after the all the session. Yeah, and in the hospital, Dr. Eric, basically the nurses will bath the baby with warm water because of the temperature. Because in our nursery we use aircon, right? Air conditioner. So most of the time we will bath a baby with a warm water
So,
in the hospital setting. In the hospital setting, we will absolutely use the warm water to bath the
okay.
baby.
Yeah. If not, they'll go too cold actually. Yeah. All right. So we've been chatting a lot regarding this bathing stuff as well. Why don't we just have a little chat regarding this medical viewpoint regarding this what do you call this skin to skin contact, Dr. Reza. I mean, we do know that a lot of people. I mean, even if baby just born, we would encourage to put the baby first time to the mommy's lap or in the chest for skin to skin contact. But actually, in how does it really help the development of the baby with all this I mean, you know, skin kind of contacting?
Okay, so normally what we do in skin to skin contact is you after delivery, you put the naked baby onto onto the mother's chest. You just imagine that the baby is naked. So you just put onto the mother's bare chest, for about 1 hour. So the mother's warmth will actually regulate the baby's heart rate and regulate their temperature. And then so it actually make them more calm. And then when you put them skin to skin, they will start looking at their mommy. So that actually promotes sensory and brain development. So what happened in skin to skin contact is that when you put the baby onto the mother, you actually reduces the cortisol level. Cortisol is the stress hormone that we have in the body. So the moment that you put the baby onto the mother, onto the bare chest mother, it actually brings down your stress hormone level. So when your stress hormone level is down, it allows the baby to become more relaxed, and they regulate their temperature better, and they actually use up their good fat to actually maintain their birth weight. You have to know that the first 1 or 2 days, baby usually lose a bit of their weight. Let's say if they're born like 2.5 kg, after the first or 2 days, they may be like 2.3. But if you do this skin to skin contact, you will notice that there won't be a loss in the birth weight. They are
Oh,
actually
okay.
able to they are actually able to retain their weight because they actually use up their fat.
Okay,
Use up
okay.
their body fat. They somehow regulate their body to use up the fat. So
Mm-hmm.
they are able to maintain their body weight. Yeah. And
Mm-hmm.
the low level of cortisol also causes them, make them to have a better gastrointestinal environment.
Mm-hmm.
They digest and absorb nutrient better. So
Uh,
that also helps them to maintain their birth weight.
oh, okay, okay, okay. It's very interesting actually. So much effort actually ongoing with a very simple skin to skin contact, yeah.
Yeah, yeah, and it also helps. It also does help the mother as well. Yeah, because
Mm-hmm.
what happened, even during the skin to skin contact,
Mm-hmm.
the mother's cortisol level is also lowered.
Mm-hmm. Okay.
So you actually reduce the risk of postpartum depression.
Ah,
You
okay, okay.
I mean everybody knows that when you put them skin to skin, you develop, bonding, mom maternal
Yeah,
bonding. I think that one
yeah,
everybody knows. Yeah,
yeah, yeah.
bonding was the main thing.
Okay, okay. But what about any other? What do you think? Other than skin to skin, any other like early interactions between the mommy and the baby? Do you think that will be quite crucial or important in the development of the baby? Any other
I mean,
specific
in
interactions?
the first 1 month, of course, you cannot give them toys and everything.
Yeah,
First
yeah.
1 month, is actually all this touching.
Mm-hmm.
You must always put your baby close to you. Not to say carry them all the time, but put them near you so that whenever they wake up, they actually see your face or daddy's
Mm-hmm.
face. Just have someone to be around when they wake up. Not to hold them 24 hours, but to be nearby so that when they wake up, you are there, right?
I see.
And always talk to them.
Mm-hmm.
You can actually stimulate babies as early as 17 weeks pregnant because at that time they have already developed their hearing. So that's why
Oh.
people believe in putting, as a Muslim we put ayat Quran. So
Mm.
mothers, put music, onto
Mm-hmm.
the belly because
Mm-hmm.
baby can already start hearing when you are 17 weeks pregnant. So
Okay.
talking actually a form of stimulation. Yeah.
Mm-hmm.
If you notice that if you talk to your baby a lot, they will also start talking early. You understand?
Okay, okay, okay.
Ah,
Huh?
so
Yeah,
you must
that's
always talk to them, and please don't talk to them with baby language. That's like a normal people talking.
okay. I
Don't
mean, more
talk baby
smooth.
talk. You talk like normal.
Okay,
So
okay.
talking and singing, those are the kind of stimulation that you can use on your
Mm-hmm.
newborn babies. Of course, after 1 month and 2 months, it will be a different thing.
Mm,
Toys,
okay.
sensory, watching. But the first 1 month is all like talking, singing,
The,
and
the, the hearing kind of stimulus. Yeah. Yeah.
yeah,
Okay.
because when you talk, they can hear, and when they hear, it actually develops their brain.
I see. I see. All right. Okay. Thanks, Dr. Riza. But I mean, Miss Alpani. So, as a nurse in Gleneagle, I'm very sure that it's very common for the nurses to, after bathing the baby, you perform some form of massage, yeah, to try to relax the baby, or for the reason particular, as I was told. So, do you mind to like share with us how does this massage actually would really does it really help with the baby bonding or the growth or emotional development or any experience that you could correlate with this particular process, this massage thing? Mhm.
All right. So personally, for me, absolutely, a baby massage will also give a lot of benefit throughout your parenting journey. Okay,
Mhm.
other than bath the baby properly, Massaging your baby also, actually, for me, a baby massage is a way how you communicate your love to your baby throughout your touch, right?
Mm,
Because you have your eye contact throughout the process of the massaging. You will always keep talking to the baby, sing to your baby, all right? So it's actually the way how you tell your baby that you love them so much, all right? So this is why baby massage is very beneficial for the baby, for their brain development, emotional development, psychological development. It's not only that your baby are relaxed after the massage, but actually it will help throughout the baby development afterwards.
I see. I see. All right. So, baby massage. We do apply lotions or sometimes they put lotion oils or anything when we apply for after we bathe the baby. So, does that really count skin to skin contact, or is there any benefit for doing that, Doctor Rolisa? Do you think we should do all this?
No, massaging is what we call touching, just like Miss Apani said. Yeah, skin to skin is purely like naked baby or your bare chest, so that is skin to skin contact. So massaging is totally not skin to skin contact. That is mainly touching, right?
Okay.
And touching is very important. I mean, you must always touch your baby. So when your baby is crying, you should just lift them up a bit, touch them to calm them down. Yeah. So touching is very important. It's very important for their social, emotional, and cognitive development. I think Miss Apni mentioned that. Yeah. And infant massage is also good for babies who has colic. I personally find that massaging is very good to actually reduce infant colic. Yeah, when they are fussy, they got a lot of wind, they cry non-stop. You try massaging them. Yeah, try massage the tummy. That love shape massage on the tummy. It really helps it really help and improve their symptom. Yeah.
I see.
So
I see.
that's why even before they start having all this colic, so it no harm in doing massage on the tummy itself, yeah, so
see.
that you reduce the incidence of colic.
Mm-hmm.
They
I
become
mean,
less
well,
fussy when you massage them. They become less fussy when you massage them.
okay, okay. So, I mean, infant massage actually, if you want to delve into how to perform an infant massage, is gonna take.
Infant massage is a totally big thing.
Yeah.
It's like
We will
one
come
whole
back.
big topic.
We will come back again in
Because
another.
you must know how to massage. There's a method to do it. There's a
Yeah.
method to it. Yeah,
We need
how
another
you
workshop.
hold, massage the feet, the calf. Yeah. So
Yeah.
it's one whole big topic.
Yeah. We need definitely another workshop for it.
Yes.
We'll let mommy, daddy, and I to go.
But infant massage has got a lot of benefit. It definitely has a lot of benefit. Yeah.
I see. Okay, so thanks again to Ms. Afani and Dr. Reza for a really good explanation. So, I mean, just a little bit, slightly a bit not related to bathing all this, but I think it's one of the most concerning part for all the mummies out there. So, a very interesting topic to catch our attention is jaundice in newborn. Yeah. Do you mind to, Dr. Reza, do you mind to just walk us through regarding this, a really brief idea and what does actually the parents need to be a bit more aware or careful of regarding this?
Okay, jaundice. About 50% of our Malaysian babies will get jaundice. Yeah, most of the time it's physiological because of liver immaturity. So when your liver is immature, you cannot excrete your bilirubin, and you would expect them to get jaundice after 24 hours. That means on the second day or the third day, they will start getting, jaundice, and it should disappear between 7 to 10 days of life. Yeah. So how do you determine whether your baby has jaundice or not? So that's the most important thing. It's how for you to see whether they have got jaundice. Yeah. Of course, in fair skinned babies, you can actually see from the skin. So even if you press on the cheek or on the forehead, you can actually see that they are yellow. or you can also see it from their eyes. The eyes becomes a bit yellowish, then you know that they are jaundice. Yeah, and you can actually go by level. Usually they start on the face, then it goes down to the chest, tummy, and down. If it's already down, that means your jaundice is very high.
I see.
And I usually advise parents, how do you prevent your babies from getting jaundice? Yeah, you make sure that you feed them adequately. Yeah, feeding must be adequate, because if they are dehydrated, then their jaundice becomes severe.
Okay,
You
okay.
must make sure that they are fed adequately. So how do you know whether they are fed adequately? In babies, especially when you are breastfeeding, you must feed them at least 1 to 2 hours every day. No, every 1 or 2 hours. Yeah, that means minimum 12 times feeding. So if they are the type that sleep, you have to wake them up for feed, because if not, they will be dehydrated and feeding is inadequate and they will get jaundice.
Okay, okay.
Okay, and if you feed them adequately, they will pass motion a lot, and that
Okay.
is one of the way how you excrete your bilirubin.
Okay, okay.
Okay.
So I mean, and any like red flags I need to be a bit more. We need to be a bit more concerned. Like this jaundice is when baby is jaundice to this point already. If something is not right, I really need to be.
I know I normally we play safe, okay, just like I said. You can actually gauge your jaundice according to your level, the face, chest, tummy. Yeah. So usually when it's at the level of the chest, that's the level when you may need phototherapy, right? Phototherapy is the light that you how you bring the jaundice down. But to be on the safe side, so the moment that you see the face is already yellowish, or you can see the eyes are a bit yellow, always go to the clinic or hospital to just get the bilirubin level checked. So that would be the best way for you to gauge, is it serious, that whether they need phototherapy or whether you can still take the baby home. Yeah. Once you see the face is yellow, you just go and have the bilirubin checked.
Yeah, yeah. I think that is most probably the most important thing because no point talking about it.
Because if I were to tell, okay, the moment the bilirubin is at the chest level, then you know it's high. But yeah, your level of looking at the chest and my level looking at the chest probably
Yes,
different,
that is
right?
totally fine.
So the
Yeah,
moment that you think that the baby is jaundice, just go and have it checked.
yeah.
We
Get it
are
checked.
being sick, right? Because you cannot allow the jaundice to go very high, because it's not good for the brain.
Yeah, correct. True. Why not? We just how should I summarize it? But basically, so for us, the folks out there, I mean, no point we talking about if severe jaundice, super severe jaundice, how to differentiate it. As long as you see your baby yellow, just feel free to bring to the pediatrician
Yes,
or your
yes. Yeah, my
practitioner to get.
advice is usually that, yes. Yeah,
Yeah,
because you
that's it.
never know what the level is unless you go and have it checked.
And,
So
and
the moment you notice that yellow, you just bring it to the doctor. Then the doctor will advise you accordingly. You know what to do.
Yeah. Okay. And probably one of my advice from me actually, because one of my experiences, I had parents that actually, I think there's still some they like to bathe their baby with kunit. Yeah.
With
Which
what?
is kunit.
Oh, kunyit. Oh, okay. It
Yeah.
won't
So
help. It won't help. It
yeah.
won't
Some
help. It won't help.
kunit.
And
Yeah.
and also you put them under the sunlight. That also will not help.
That's totally not gonna help at all, right?
It's not
Yeah.
gonna
Yeah.
help at all. Yes.
Then they might end up dehydrated. Even more problem
Yes,
comes up.
yes. You actually make them more dehydrated. Then you actually jaundice will go up instead of going down.
I see. All right. Thanks again, Dr. Reza, for such an insightful information. I mean, well, I mean, ladies and gentlemen, true enough, we have only a 1 hour session today. So we are actually trying to pack as much as possible topics and discussion through in 1 hour session. Yeah, I mean, there's so much more to discuss, but time is that limited. So we really thanks again to Dr. Riza to help us out for this, giving us a lot of information from a medical perspective. Well, I mean, then of course we would like to hear a bit from Miss Alpani as well. I mean, as a mother of three, right? Three.
Yes.
Yes, a mother of three. What's your, I mean, ultimate advice for everyone? Summarizing regarding today's all, we have talked so much today, but what would you be your ultimate advices for all the parents out there?
Okay, for me, knowledge is power. Okay, prepare yourself with all the information that you need to know. Right? It's not like the pregnancy itself, because most of the new parents, they are very excited about their pregnancy. They even have an apps in their phone, like how many weeks, how big is the baby. It's just like watermelon size, orange size. They are too focused on the pregnancy, which is only 9 months. They forgot about the journey after that, which is longer. The breastfeeding journey, the journey on how to bath the baby, how to massage a baby, how to stop baby from crying, which is how to grow a baby, which is a lot of things to do afterwards. So just get ready, prepare yourself with some knowledge. So at least when you encounter any issue, any challenging throughout the journey, you have some basic idea on how to overcome it, or you know where to refer back if you don't know how to solve it yourself or solve it with your husband. Because I'm very sure as a new parents, especially if you are a first time parents, you will receive a lot of input from everyone, like telling you to do this, not to do this, this is what you're supposed to do. So at least when you have some basic knowledge, which is according to WHO, Ministry of Health, or UNICEF, so you know which one you're supposed to follow. It's not just based on some or people experience. That is the most important thing that you need to prepare. So for those who are joining us today, congratulations, you did a good job. So at least now you learn about the bathing technique, some of skin to skin input that we get a lot of information from Dr. Rodiza. Even me myself also, I learned something today. So I'm very sure the parents that joining the class, the session today will benefit a lot from our discussion as well. Don't stop learning, keep learning, and then just relax and don't be like overwhelmed with the pregnancy and after delivery.
Yeah, thanks, Miss Alpani. I mean, always look for help if you're in trouble. Yeah. Okay, so I think unfortunately we had actually really come to near the end of the session for the day. Thanks again, Dr. Roliza and Miss Alpani for a really informative session for today. But I think we would come to a session for a Q&A session. So that probably I can check what questions I can see from the audiences. All right, so Ms. Wani Jamiros, my newborn got jaundice. Should I bath him with herb water? Yes, this one was
No, it won't work, no. You will stain the color yellow, no? No, it will not help the jaundice level, so no need.
It's a big no.
No,
Okay.
yes.
All right. Any more questions? Let's bring up. Yeah. Perlu ke cream lotion untuk newborn? Maybe Miss Alpani can help us out with this.
Right. So like what Dr. Roliza said just now, it's very important to keep the baby skin moist, right? So lotions, baby oil might be helpful to keep the baby's skin moist.
Okay.
Lotion
Alright.
is actually better than powder.
Yeah, don't use powder, Dr.
Don't
Right?
use powder.
Yes, don't use powder. Is
Dry skin, you don't never ever use powder, especially when the skin is dry.
Yes, powder
it
is.
makes it more dry.
Yeah, it will make it drier.
I see. Okay. All right. Do you have any more questions? Yeah, let's see. Mr. David, how long should we massage baby after we bathe a baby? Miss Alpani, do you have any advices regarding this?
All right. For baby massage, okay, we just take around 15 to 30 minutes. After
Mhm.
we don't take too long, like 1 hour, 1.5 hour massage, like when we go to the Bali spa and Thai massage, which is longer. So 15 to 30 minute massage, it will be supposed to be enough for you to perform. Because the baby is very small, we don't
Yes.
take too long, yeah,
Yeah,
to
yeah, yeah.
massage their whole body.
I see. Okay. All right. Eczema newborn. This is very interesting. Actually, I think a lot of people will be very super concerned. Eczema newborn. What should we use to bathe? Dr. Riza.
Okay, so you know when they have got eczema, that means the skin is very dry, yeah.
Mhm.
Jadi the bath, the wash that you must use is all hypoallergenic and fragrance free. That's the most important thing, yeah. Because all those baths with fragrances will actually cause the skin to be even drier. Ya, jadi
Mm,
you use wash that is hypoallergenic, fragrance free, and there's a lot in the market. So you can just go to the pharmacy and see those for sensitive skin. And the most important thing is fragrance free.
mm, okay. Okay. All right. I see. All right. Probably we'll just allow one more questions because we're running out of time. Uh, daughter of Nadarajan. Congratulations. I'm sorry, daughter of Nadarajan. Okay, never mind. Hi, doctor. I have few mothers out there stop breastfeeding due to jaundice. What is the advice for them?
No. Okay. Actually, we encourage you to breastfeed more if they are jaundice. Yeah, because if you breastfeed them more, because in breastfeeding they will actually feed very frequently. So if they feed very frequently, they will pass motion frequently. So
Mm.
that's how you bring the jaundice level down. So never ever stop breastfeeding even if your baby is jaundice. You should breastfeed more.
Ah,
I just want to add on. In our classroom, it even contain a laxative, right, Dr. Raliza, that help baby
Yes,
to
yes,
pass
yes.
motion more. So because
okay.
So
doctor did
they
mention
pass
just
motion
now,
quite easily, and
yeah,
that's one of the way for you to excrete your bilirubin.
yes.
Mm.
Like what Dr. mentioned just now, the bilirubin will extract more from the baby's poo. So the laxative in the breast milk will help the baby to poo more and help the bilirubin actually to suppress faster,
Yes.
go down
Mm.
faster.
So you
So
bring
never
down the
stop, just continue.
you
Never
help to
stop.
bring down the yellow by poo poo and shishi of the baby lah. Yeah.
Yes.
All right, I think that's pretty much it for today. Once again, I would like to thank you to both our talented speakers here, Dr. Reza and Ms. Penny, for today's session. I believe all our audiences out there had really learned so much from you too. Yeah, we would really thank you to express our utmost gratitude to both of you for sharing your lovely time with us and as well as sharing all your experiences as a teaching as well for all of us to have a better insight, and hopefully all of us, our daddy mummies out there, will be a taxi bit more ready for their upcoming baby. Yeah. So thanks again. I hope to see both of you soon again. All right. Thanks again.
Thank you for having us.
Bye.
Thank you
Yeah.
for having
Thank
us also.
you.
Thanks, Loreza. Thanks, Miss Penny. So, ladies and gentlemen, that pretty much sums up our event today. But wait, we have yet to come to an end because today, ladies and gentlemen, we have this lucky draw session brought to you by Baby Carrie as well as Lotus. So, we will be giving away 10 sets of this Baby Carrie products along with 50 ringgit of a Lotus voucher. So, which is you can see from here, this gift set contains our Baby Carrie liquid cleanser, head to toe wash, gentle wash, Baby Carrie baby bath, Baby Carrie lotion, bath, and baby oil. So, as one of my concerns is some of you might not be familiar with Baby Carrie. But as what I'm trying to tell you all of you guys, Baby Carrie is a sub branch from Carrie Junior, where they tailored their product more for their newborns, for the newborns out there. So if you were thinking, oh my God, just now we're chatting about so much stuff with hypoallergenic, paraben, sulfate free, 100% certified or organic stuff, everything. We're so concerned regarding which and what not to choose for the lotion or bath for your baby. Well, I mean, if you're concerned and you're headache regarding which and which should not to choose from, well, Baby Carry actually solves most of your problem already. So yeah. So right now we will be putting up a question. Yeah, putting up a question. So please do kindly comment your answer in the chat box. Yeah. Right now we can see Baby Carry Head to Toe contains 100% organic plant actives and is perfect for newborn babies. Answer your question now. Comment it right in the chat box. Yeah. For all, we will giving out 10 winners. We'll be giving out to 10 winners, which we'll be announcing in around 1 week from now, ladies and gentlemen. My person in charge will contact you personally subsequently. All right. So we will give, okay, next question. Moving on. Baby Carry Liquid Cleanser is an ultra gentle fragrance-free formulation suitable to remove milk stains easily or wash your baby toys, fruits and vegetables, or both. Well, I mean, this is actually quite straightforward, you know. Surprisingly, this liquid cleanser, Baby Carry Liquid Cleanser, is very, very safe, not only to the toys, and even it's safe for consumption to the baby as well. Not to us it consume directly, but it's safe for it to be consumed and drop into the mouth as well. Yep. All right, we'll move on. 2 questions only, ladies and gentlemen. I hope all of you had answered all your questions. Yeah. With the most accurate and the fastest audience who answered the questions, you will stand a chance to win this, what we call this lucky draw gifts that we will be giving out to you. Total of 10 sets, which is, as I mentioned, Baby Carry Liquid Cleanser, Head to Toe Wash Gentle Wash, Baby Carry Baby Bath, Carry Lotion, Bath and Baby Oil, as well as 50 ringgit of Lotus voucher. So I think that's pretty much all for today. And before leaving, one last thing, please don't forget to sign up as a Mommy, Daddy and I member, and share this video to your friends and family members. And for all those upcoming daddies and mummies out there, I wish you to have a really, really smooth journey in delivering a baby, and be brave and get ready to tackle this journey that is full of excitement. And I hope to see you real soon. This is Eric speaking to all of you. Good day and goodbye.